Uh, Thanks again. In today's presentation, I'm going to present on Canada's COVID-19 policy response and looking at how the government implemented the Gender-Based Analysis Plus framework. And just a small introduction about the project, the Gender and COVID-19 project. We aim at identifying gendered effects of the response to COVID-19, highlight policy gaps and opportunities, as well as provide guidance and tools to decision makers. And we are in several case studies, as Julia mentioned, and as outlined in the map there. But of course, today we are sharing evidence from research in Canada, BC, and this is based on analysis conducted for an upcoming journal article that's co-authored with Dr. Julia Smith. And feel free to visit our website to look at the different case studies that we are working on. In Canada, the government has a commitment to do Gender-Based Analysis Plus, which is an analytical tool used to assess how diverse groups of women, men, and diverse people may experience policies, programs, and initiatives, and looking at it from an intersectional point, so thinking of ethnicity, race, sex, education, etc. In BC also there is that commitment. In 2018, the government made the commitment to ensure that gender equity is reflected in all budgets, policies, and programs. And of course, these are pre-COVID-19 commitments, and studies have shown that in prior pandemics, gender equity concerns and commitments are often neglected and deprioritized in public health crisis. And it's a phenomena that Dr. Julia Smith highlights in a 2019 paper as the tyranny of the agent taking over in such a crisis situation. In this analysis, we look particularly at the secondary impacts of COVID-19. So thinking of impacts on livelihood, on social protection, on care work, and particularly looking at the British Columbia as a case study with a timeline of March to July 2020, so the initial impacts of the pandemic. We did our analysis using through lived experiences, and that we were able to do through interviews. 24 semi-structured interviews, 20 women and 4 men, and also did key informant interviews. We conducted a documentary analysis of COVID-19 related policy documents at the federal and provincial level, as well as government reports. And we also did a literature review of prior analysis that was done on the impact of COVID-19 response policies. And this is a product of the analysis we did, where we did some thematic mapping. And this was based on the UN COVID-19 Global Gender Response Tracker definition of gender-sensitive measure, which is defined as those that seek to directly address gendered risks and challenges caused by COVID-19 crisis, and particularly violence against women and girls, women's economic security, and unpaid work. And as this map shows, there were some gaps that we realized in this study, and that I will talk about a bit later. I will start with looking at gender-based violence as one of the policy areas that was addressed by the government, and where we realized that shelter, which was the focus of the responses, do not equal security. The stay-at-home advisory was based on messaging around stay home, stay safe. However, as we know, home is not a safe space for everyone. There were service providers reported increase in both the prevalence and the severity of violence against women. In Vancouver, we saw helplines calls increase by 300% in April 2020. The federal government responded by increasing funding towards shelter and related services, as well as virtual mental health services. And we realized that this funding really benefited service provider. However, it filled a gap that existed pre-COVID, as well as catered for new demands such as requirements around physical distancing and maintaining isolation units. Shelters and transition housing is a sector that is underfunded and is under-resourced, and it's estimated that in pre-COVID times, 620 people were turned away from shelter daily across the country. And also, as a key informant told us, transition houses in BC have the highest rate of casual staff of any province or territory. Folks move from house to house and maybe work at a school or in a nursing home. And this just shows a case of precarious work in this sector, as well as under-resourced in terms of human resources. A situation that was exacerbated through the single site staffing policy, as well as demands around childcare. What we noted as drivers and determinants in speaking with project participants is that childcare interruptions increased conflict and contact between separated parents, and this really increased the risk of violence as well as the sense of insecurity. As a single mother shared with us, there was a case of domestic violence. It's very triggering to be close in the proximity of my ex. And because our kids not going to daycare anymore, we have to do exchanges in person. Participants also shared of how court closures protracted conflict. And the focus on virtual mental health services also meant that some people could not access these services because of lack of technology, as well as privacy issues. And as one of the key informant mentioned, a counselor, some people really need that physical connection to open up and to start, sharing and healing. And on the economic front, the reality was that women make up 47% of all workers in BC, but accounted for over 60% of the COVID-related job losses during the 6 months of the pandemic, the first 6 months of the pandemic. Over 50% of women work in industries and occupations most impacted by COVID-19. And, thinking of also occupations that were most impacted, women being concentrated in low-paid jobs, in part-time jobs, temporary work. And these are really occupations that were more likely to be to experience job loss, as well as reduced hours of work. And this is also a trend that reflects the gender roles associated with the type of work likely to be done by women, as well as norms around unpaid care work. With regards to the sub benefits, which was the biggest benefit around this at this time, where over 50% of the beneficiaries were women, many respondents or participants reported relief from sub and other benefits. They appreciated the simple application process and really highlighted that this relief had more than just financial impacts, but also helped in terms of their mental health. And as one mother speaking about the daughter shared, she was so stressed, her hair was falling out in clumps. So when the government came out and said there will be money for university students that they could apply for, she was thrilled. So there was that relief, and single mothers also sharing of how this support was a lifesaver, and they could not imagine, how they would go through that time without this relief. However, participants also shared that money does not equal necessity, and that lack of childcare really was a barrier for translating the financial benefits to meeting their needs. And as a single mother shared with us, my fear was I don't have food for my son in the fridge. That was my biggest fear, because I know I have money in my bank account, but there is nothing in the store, and I feel like I'm supposed to not take my son. There were also barriers to actual access to the financial relief. Many were excluded from the CERB, and newcomers particularly highlighted that the 5,000 prior income in 2018 requirement as a barrier. And it is estimated that this requirement left 175,000 workers without income, primarily those working in the food and accommodations, retail, arts, culture, and sports industries. So that was quite a barrier. Also, there was a barrier to part-time workers accessing these funds, and particularly those who had an income of 1,000 and above. And as one newcomer essential worker told us, I work in 2 centers if they have work. And because I'm on subcontract, I don't apply for sub because I make $1,000. It's not enough. And so really, this did not benefit people living on low incomes. There was also an exclusion of essential workers who left work out of fear of infection, and we had this from early child care workers, some of whom decided to stay in their works because of this requirement, despite really their fear and anxiety around COVID-19 exposure. Also, those who had precarious immigration status were excluded from CERB, and these barriers were mirrored in the BC emergency benefit for workers whose eligibility was tied to CERB. So if one did not receive CERB, they will not also be eligible for the BC benefit. And the last category I'm going to look at is the unpaid care work. Participants shared about the triple work burden, or the triple burden that they faced, where they had to do their paid work, unpaid work, and also domestic and community management. And unpaid work also include homeschooling, as well as increased care needs of the elderly parents. So we saw these roles really moving from the paid economy to the unpaid economy, and this responsibility was mostly shouldered by women. Even before the pandemic, women in Canada did 2 to 3 times of the unpaid work compared to men. And as one single mother put it, when something like this happens and we are asked to work from home and also care for our kids at the same time, it's kind of like we understand that it's 2 jobs, but the system does not recognize it as 2 jobs. Other mothers also shared that they recognize they take this responsibility almost voluntarily because they feel like it's their responsibilities. And in some cases, some men we spoke to mention of supporting or having to help their partners, really reflecting their internalization of this role as a secondary role for them. Compared to other provinces, BC made the largest financial contribution towards supporting childcare on top of its federal funding. And parents benefited from increased childcare benefit. And one key informant, however, mentioned that although parents had this money in their pockets, it doesn't equal childcare. So this triple burden was still being experienced. And of course, this comes at a cost. The cost that women spoke about is, lost paid work or reduced hours. In April 2020, mothers aged between 24 and 55 lost 26% of their work hours for family and health reasons, and this is compared to 14% of their male counterparts. And also, some women left work to provide childcare, and this is also a product of the Canada gender pay gap, where the partner with the lower income will essentially be the one staying at home to take care of the children. Other costs that women spoke about is mental health, costs on mental health. They talked about stress, anxiety, and mom guilt. And in one survey, over 70% of women identified unpaid care work as the primary source of stress and anxiety during the lockdown. And one mother, as she was describing her role in childcare, mentioned that this was really a 24-hour mind work, really showing the mental load that it has, especially on single mothers. And some mothers we spoke to shared of this residual stress that was just bubbling in the background. You think you're fine, and then you just start crying. And they also shared of having, with regards to mom guilt, they shared of, the guilt of having to put their children in front of the TV so that they could do some work, or having to take them to the store and being impatient with them. And that was really impacting their mental health. Participants also shared of having no time, particularly mothers, having no time or energy for self-care after a day of childcare. And as one mother who was part of a support group, or single mother support group, shared or asked, when are we actually going to talk about our pain and suffering when our children are not listening? And as a key informant collaborated, there was a decrease in access to virtual support services due to childcare demands or lack of access to technology. And in our analysis of unpaid care work, we also realized there was virtual education gaps, with education moving online and moving to homes. And this was because of lack of technology and financial resources to facilitate homeschooling. And also newcomers were worried about being able or not being able to support their children. They experienced language and knowledge barrier. As one newcomer mom told us, his teacher sent the homework, and I should study first by myself and then explain to my son. That was a big headache for me because it's so hard. I'm not good in English language, and everything that we learn in school is different than here. Parents with children with disability also shared about being cut off from services. A mother was anxious that childcare closure had interrupted her child's speech therapy, and another noted lack of childcare, meaning that lack of childcare meant that the son was no longer seeing a specialist who was helping him overcome severe anxiety. And she shared how it returned to a point where he became like physically ill because of this anxiety. And in our analysis of how gender-based analysis plus was implemented in the COVID-19 policy responses, was that the GBA plus is narrowly applied, or was narrowly applied. And in looking at all the policies targeted at individuals, and these exclude benefits around businesses and the economy in general, only two are highlighted, or we saw that were gender sensitive, and these address gender-based violence. Women were seen as victims and not as those sustaining COVID-19 response through their unpaid care work. The focus on financial relief also did not necessarily translate to met needs, nor eased triple burden on women. Gender-based analysis plus did not reduce inequalities and protection against further rights violation. And we had some recommendations. First, the continued application of gender-based analysis at the federal level and an extension to the provincial level will be much welcome. And this analysis should indicate if gendered risks have been addressed, not just recognizing them in the policy process. Also, investing in addressing drivers of, not just responses to gender-based violence, and this should translate in terms of access to justice as well as childcare, and also in the importance of centering lived experiences in gender-based analysis plus. And participants actually shared very insightful ways the government could have met their needs better. Suggestions like having a centralized place like schools or libraries where they can access and even buy PPE and healthy foods because of not having childcare, or just the challenges of going into grocery stores around that time and supply shortage, etc. Other recommendations include addressing gender norms that force women out of the workplace during crisis, and to absorb this triple burden on women that we have realized comes up in times of crisis. Also ensuring access to necessities as well as finances, and really this coming to also translating to closing the gender wage gap. Also address the need to address digital divide fault lines, as well as improving access to mental wellness, keeping in mind the lessons that we have learned, and also adapting a gender responsive pandemic plan in case of future pandemics or public health crisis. Thank you so much for listening.